All right, we will go ahead and get started. Welcome everyone and hello. We are in the Beyond the Classroom panel discussion today presented by Common Threads. We're so pleased to have our 4 panelists with us here today along with our attendees from all over the country. Our panel is being presented today by Blue Cross Blue Shield of Illinois, and a special thank you to them for supporting today's discussion. Common Threads is a national nonprofit organization that provides cooking and nutrition education programming to children, families, and educators in under-resourced communities in 12 markets throughout the country. Throughout the pandemic, we've continued to fulfill our mission by providing digital programs, including our 10-day virtual summer camp, while also supporting community-based food distribution efforts and advocating for policy change to help children and families who are facing difficulties during COVID-19. Before we get started, we'll cover just a few of the quick housekeeping items. Most viewers will probably prefer to use speaker view so that you can see the panelist who is currently speaking. If you're not familiar with Zoom, you can access this by clicking the speaker view icon in the upper right-hand corner of your Zoom screen. Our Zoom is set up so that all participants are muted and screens are turned off, with the exception of our panelists, of course. Today's session is being recorded and it's also streaming on our Facebook page where it will be live for people to view on demand. And finally, we'll be taking questions for the panelists. So if you do have a question, please make sure to submit it in our question and answer window down at the bottom of your Zoom screen. Our co-founder and CEO, Linda Novick O'Keefe, will be moderating today's panel and will introduce our 4 esteemed panelists. Thank you again to everyone for joining us today.
Good morning, everyone. I am so excited about today's panel. We have 4 really bright, kind, thoughtful individuals that I've had the pleasure of working with. I'm going to start by asking you, Pam, to start with introductions. Thank you.
Sure. Well, hello, everyone. My name is Pam Miller, and I am the administrator for USDA's Food and Nutrition Service. It's really a pleasure to be with you. Do you want me to continue, Linda?
Yeah, do you want to just, how about if you provide, guess, your name and then your role and maybe a little bit of background.
Sure. So again, I'm administrator for USDA's Food and Nutrition Service. Many of you may be familiar with the fact that we administer 15 federal nutrition assistance programs. We work very closely with our state agencies who work very hard to implement our programs on the ground. They work with key partners like our schools, of course, and other stakeholders who help deliver the programs. I'm really pleased to be here. I've been administrator for USDA's Food Nutrition Service for about a year. I was with the agency for a year before that as a senior associate administrator for policy. And before coming to USDA, I worked on the Hill. I worked for the House of Representatives. I was professional staff for the House Agriculture Committee. So worked on several farm bills, which helps provide the authorizing legislation for many of the nutrition assistance programs. And then I was on the House Ag Appropriations Subcommittee. So that's where we get the funding for many of the programs. So it's really great to take that experience from the Hill and seeing how we authorize and get the funding for many of the things we do at USDA and now be over on the implementing side. So it's really a pleasure to be here.
Thank you, Pam. We're so glad to have you. Kevin, you're up next.
Hi, everybody, and thanks for having me, Linda. My name's Kevin Brown. I'm the executive director of the Texas Association of School Administrators. I have a 30-year background in public education as a teacher, assistant principal, assistant superintendent, and spent the last 10 years as a superintendent in San Antonio. I'm in my 3rd year as the executive director at TASA. We provide professional learning to all of our members. We have over 1,000 school districts in Texas. We also do advocacy work for public schools, and then we provide a lot of services for our members in a variety of formats. I'm really glad to be here with you today.
Thanks, Kevin. Ken.
Okay, hey everybody, hi. I'm Dr. Ken Fox. I'm the Chief Health Officer of the Chicago Public Schools. I've been a pediatrician for over 30 years, and as chief for 4 years. And I must say, this has been the challenge of my career. An amazing bookend. You know, when I was training to become a doctor, you know, the HIV pandemic was just emerging, really. And so I find myself in this season of my career at another important pandemic challenge, a bookend, if you will. And I guess I would say nothing clarifies who you are and what you're about like an existential threat, which this most assuredly is. And so being engaged in that has been an incredible challenge. It's incredibly exciting because I have an incredible team, and I'm glad to be part of the discussion today.
Thanks, Ken. Chris?
Hi all, good afternoon. My name is Chris Chacarico. I'm the Senior Executive Director for the Office of Food and Nutrition Services in New York City. We are obviously inside of the Department of Education. We feed about 1 million kids a day. I know that's a large figure, but I just got to throw that out there every time we talk about the meals that we serve in New York City. We have about 1,800 schools. We're in over 2,000 kitchens across the city, including charter schools and non-public schools. My background, I come very similar to Kevin. I'm a former teacher and principal, worked in support services for a number of years, and I'm just getting to my second year as the Senior Executive Director for the Office of Food and Nutrition Services.
Thanks, Chris. To frame up the conversation, in March 2020, following the announcement of COVID, all of you, from the federal government to the different school districts and the Department of Education at the state level, have all been working together to respond to food insecurity and fill the gap of missing meals. So the USDA initiated a series of programs to address food insecurity in response to the pandemic, from cross-sector partnerships to piloting solutions in rural markets to pressing the go button on SNAP online purchasing to mitigate the effects of children not having access to meals provided by and at their school. The USDA and State Department of Ag, as I said earlier, are working closer with school districts now more than ever to close the gap. Today, we're going to discuss what's next. Due to cumulative costs of food, transportation, and healthcare, families with children do not have savings to be able to sustain an emergency, and this is why we're seeing higher levels of food insecurity in families. A variety of people and organizations have stepped in to help those facing hunger and food insecurity. For example, food banks and other nonprofits have been helping, given the unprecedented demand for services and food, particularly at a time when food manufacturers and purveyors were experiencing supply chain challenges as they're trying to shift and pivot due to the pandemic. I will say that we have seen firsthand how critical nonprofits are to our communities. So many of the schools and elected officials are calling for the support of community organizations, and sadly, many of these organizations are facing reduced funding. School districts created their own distribution strategies, which I'm excited to have Chris here to talk through, to ensure grab and go and delivery options were made available so that students were not missing meals. We also saw individuals step up, including caretakers such as grandparents, neighbors, aunts, and uncles, to support parents who had to be on the front lines. The New York Times did an excellent photo story a few weeks ago called "America at Hunger's Edge," and it quoted a grandmother who said she's preparing food as if she's doing it for an army. So every state and every district is experiencing its own challenges within community. Superintendents and school leaders are balancing the benefits that in-person delivery offers, including mental health support, SEL, social emotional learning, especially for pre-K through second grade, just to figure out, you know, they're trying to balance that with making sure that kids get fed with the risks of returning to the schoolhouse model. You'll see that states are responding differently. Kevin is gonna, I think, talk a lot about that. Rural communities have been going back to a schoolhouse model earlier compared to urban cities like Chicago, which has opted to start online. So we're gonna get started on the Q&A. So Pam, you have had real experience at the policy level. Can you tell us today about a couple of the FNS policies that are on your mind that could benefit families with the persistence of COVID and increasing rates of food insecurity?
Sure. So I think that just like Dr. Fox said, it really is a testament to the great work of our staff and how quickly they have worked with our partners. And again, that's many of the folks who are joining me on this panel who are really on the ground to innovate and use those fundamentals of our nutrition assistance program policies to make sure we're getting food out to kids and to families. And in ordinary times, our programs really touch the lives of 1 in 4 Americans in the course of over a year, providing nutritious food to those in need and helping make sure we're getting folks onto a path of a brighter future. But certainly with this pandemic, every one of them has had to change their operations in light of the need to integrate social distancing practices. And so really we kind of organized around 3 key strategies. First was adjusting our program standards and processes to serve clients well in the COVID-19 environment. We've approved 4,000 program flexibilities and program adjustments across all of our programs to help ease operations and protect the health of applicants and participants. We've also been enhancing program benefits such as the SNAP, emergency allotments. We've provide access to free meals and distribution of USDA foods through our distribution household programs to really meet these expanded needs. So across the U.S., emergency allotments for SNAP totaled nearly $2 billion per month, which is in addition to the approximately $4.5 billion that's already provided in benefits for SNAP households each month. We've issued about 50 child nutrition program nationwide waivers, and those actions have really helped with the social distancing, streamlining access, and allowing for some of the flexible meal service options, which I'm sure some others will expand upon. And we've provided food again through our emergency food assistance program and making sure that we are getting food through our disaster household distributions to over 14 million people across the country. And third, I would say that we are really creating innovative partnerships to implement the new programs. Over the summer, Secretary Sonny Perdue announced a major expansion of our Meals to You program, which is where we collaborated with the Baylor University Collaborative on Hunger and Poverty, McLean Global, and PepsiCo to make sure we're getting food out to kids in rural areas because transportation is really an issue there. So between April and August, that program provided nearly 40 million meals nationwide to eligible kids in rural areas. So for all of these, the fundamental is to provide flexibilities that can help everyone meet those local needs and circumstances. And we know that one size does not fit all. And throughout the pandemic, it's really been critical that we keep the lines of communication open with the states, local agencies, schools, and program operators, because they're the eyes and ears on the ground that can give us feedback. So how we can, as quick as we possibly could, we wanted to get flexibilities out so we can help folks adjust to the situation and get kids fed.
Thanks, Pam. Kevin, during this crisis, you've been supporting superintendents and educational leaders across the state, and I think you've been meeting with them not just on a regular basis, but I mean, I guess that means every 2 weeks. Can you tell us the current status of school reopenings here in our state of Texas, urban versus rural, and just some of the challenges that superintendents are facing, and in thinking about the cost and benefits of reopening decisions. Oh, Kevin, I think you're on mute.
I sure am. That's kind of the COVID Zoom curse right there, right? All muted at some point. But, you know, I was just on a call right before this with executive directors in other state associations, and the story is, I think, very similar. It's obviously been an extremely difficult time for our school leaders in so many ways, and trying to support the students in their school districts and trying to make sure that they're fed, that they're getting education, that they're staying safe. And there's all kinds of kind of right in the intersection of so many difficult decisions that are being made right now. I'm really proud, though, of the work that everybody's done together to try to make sure that every child's needs are being met. I think in terms of the way schools are opening up in Texas, we actually have a mandate to go back to school for any family that wants their child in school full time. And that's, there's some other states that have done that, but it's made it a little challenging in that it's more difficult to do some hybrid options because you have to provide full time. Our urban areas are just now starting to open up, and they will continue to open up over the next 2 or 3 weeks. They've been phasing in slowly. Some are completely remote right now. A lot of our rural districts and even what we call remote districts have already been back with everybody that wants to be there. In those communities, often it's 80 or 90% of the families that are back in school. As opposed to our urban and suburban areas, we have a much smaller percentage of our students that are coming face to face. In particular, our low-income families are much more reluctant to come back to school right now. And we're seeing in suburban areas a much higher demand to come back into school in person. And I think that is a big challenge for us as we face even, you know, we know, all of us know that the inequities that exist today in our society, and COVID has only exposed those and extended those and deepened them, I believe. And we do have an educational crisis. I think we have a food crisis on our hand to some degree, and a social emotional crisis. Our pre-K and kindergarten numbers are extremely low. And we don't have hard data, but the anecdotal data at this point, we'll have hard data soon, but the anecdotal data is that sometimes we're down, 60 or 80% of our student enrollment in pre-K, and kindergarten being significantly down as well. So we're very worried about where those children are, because oftentimes the school district doesn't have contact information for those families because they have yet to be enrolled in school at any time, so they can't go knocking on their door to find out where they are. So we worry about those children in particular for food. We worry about it educationally, but we're also worried about things like child abuse and neglect and so forth, because oftentimes we're on the front line of identifying children in need. So I think it's remarkable what has happened across our country for people to pivot on a dime. I really appreciate the flexibilities that have been given at the federal and state level. It's been a game changer for us. And it's enabled us to serve many more people. I'm really proud of whether it's curbside or delivery to homes or, providing a week's worth of food in one kind of opportunity or pickup. I think all of those have been really, really helpful. But we got a long way to go in this, and we're going to have to continue to work and work and work. And the one word that comes to mind as I think about this, though, is grace. And I appreciate the grace that's been extended kind of across the board as we try to figure out the best way we can meet the needs of our children, especially our most vulnerable children.
Thank you, Kevin. I like that. Grace, I think we're all trying to find that right now. Chris, okay, given the number of children that that you are trying to distribute food to, how is your office handling food and meal distribution? What does that look like?
So I got to take you back to March when all of this started to unfold, and we finally got the word that we were going to be closing schools. We were watching districts around the country, and as you know, New York City was one of the last large districts to actually close schools. So we were preparing as an office in case this would happen. So a lot of our orders changed, a lot of our supply chain changed, and we made sure we had the appropriate meals for grab and go. Of course, I want to thank our USDA partners for putting in those waivers. It just made our lives so much easier. We started out serving grab and go meals, takeout meals at every single New York City school. Then we quickly realized we have so many schools on the same block, in the same vicinity of each other. We reduced to about 50% of our schools that were serving takeout meals, grab and go meals. And then the mayor of New York City wanted us to also serve meals to adults, and that was factored into what we were doing. So we went from serving around 250,000 quickly to serving almost 600,000 for adults and families, no questions asked. Obviously, we know what our reimbursement rules under the summer waiver are, so we made sure to pay attention to that, and the city was paying for the adult meals. It's been a great ride. It's been great to see my staff really rise to the occasion. All of my staff, there's about 10,000 of them, were deemed essential alongside NYPD, hospitals, firemen. So these folks have been working all the way through since March, and I take my hat off to them every single day. I can't thank them enough. No holidays off at all. They've had weekends off. The only holiday we recently had off was Labor Day because the word itself deserves a day off. But I just can't give enough thanks.
School, this changes. And I would say that the health protocols are really central to that transformation, and these protocols really are at a high priority of my office and have been the focus, a central focus of our attention. And we just try to keep things as clear and concise as they can be. You know, we talk about things individuals can do, and then we talk about the things that we do as an office or an institution. And in terms of those health protocols for individuals, obviously it's stuff like what we call do the 5, you know, hands, wash them, face, don't touch it, your elbow, cough into it. You create that force field of 6 feet around you. And if you're sick, stay home. 5 things. And we want everybody in the district to know this. We train people in the district. There's all staff training on COVID, and we also educate the families. And when we're back in person, we'll be talking to kids directly. Right now we're remote, and so many of these lessons are part of what kids talk about. But that communication piece for our staff, for our families, for our kids, that's really important. In terms of what we are doing in terms of institution, you know, in the health protocols domain, really, we're just trying to identify the cases, get them reported, and get the cases isolated fast. We do these we do our own contact tracing. So we do the intake interviews promptly. We quarantine people quick. We make sure that no mass gatherings occur. We screen people on entry to the buildings, and everybody's got to wear these cloth face coverings. So I would say the health protocols, developing the health protocols, communicating them, making sure everybody understands and practices them with fidelity. These would be the biggest priorities of the office.
Thank you so much, Ken. I'm going to open it up, the next questions, to the entire panel. You know, we've just spoke a little bit on how well federal, state, and local entities have responded to help students and families. I think it's clear that everyone's trying to do their best. What are your thoughts, and what were the learnings and strategies that have the potential to increase equitable access to nutrition assistance programs, future meal provisions through programs like the Summer Food Service Program and Seamless Summer Option?
I can go ahead and start first. A few things that, as I mentioned before, our programs are really operated, and it's a partnership between us, but really the states and what's going on locally on the ground. And so I have been really excited when we get the feedback and we see some fantastic pictures from our partners of how folks are dressing up as Star Wars characters, Clifford the Big Red Dog, and they're out on the curb delivering meals and waving at the kids. And it's really great to see how innovative everyone has been to try their very best to get food to the families and the kids who really need it. So we've tried just to make sure our flexibilities, again, can be as broad as possible so that they can adapt to what's needed in Chicago's, different than New York's, different than Texas, and just how we can let folks do what they need to on the ground. A couple of things I might mention that I think has been successful, and I know this was a huge lift for our staff, but working mainly with the states, this was a big deal to stand up that pandemic EBT program. This was a brand new program. And the fact that I think we got that up and launched in some of our first states approved within about, I think 45 days. I mean, that's unprecedented for the federal government to move that quick. And so, but it really was working with the states, and we're really proud of that work and how that benefit can really try to reach those kids in need, because it provides the value of the foods that they would have gotten in school. They then get it on the EBT card so they can purchase those foods. And so I think that's been a really good success story. We were able to approved plans for 50 states, DC, US Virgin Islands. Depending on, I'm assuming what's going to come back to us soon from Congress with the continuing resolution. I think there's more work to be done on that front as we move through this next school year, and we very much want to work with states as we go through that process. But another thing is, and you mentioned at the beginning too, Linda, is that expanding access to the SNAP online purchasing, because we know during COVID people were not excited to get out and go to the grocery store. So we very quickly worked with states to try to get the online purchasing pilot really expanded to make sure we could reach as many folks as possible. So more than 97% of households receiving SNAP have access to that online purchasing. We're continuing efforts to get more retailers into the program so we can expand. But overall, we've been very impressed with the great work that the states and schools and so many others have done. We know there's gaps, and so that's why it's important to have the feedback to see what else can we do to reach some of those kids that might not be getting the meals that they need, because we want to make sure we're serving everyone as much as we possibly can.
If I may echo something that Pam mentioned, the extension of the summer waiver into the fall was extremely helpful for us. I speak to the other food service directors across the country, trying to keep track of meals for students that are going to be taking the meals out is very hard to do. We had plans in place, we were ready to go, but when they actually let us know that the waiver was going to be extended, it was a tremendous help to be able to get more food out there that we know is needed.
I would echo the same thing. Everybody I've talked to, the area waivers were super helpful. As the open site eligibility was huge. Being able to not have to verify every single name. For our rural communities that were required to come in for breakfast, pick up their food, and then come back for lunch and pick up the food, and then the child had to be in the car. That was really an impossible situation that was very quickly addressed. And I think so that they could come in and maybe pick up 5 days worth of breakfast and lunch without the child in the car, because many of those families are driving 30 minutes to an hour one way to the school. I think one lesson to be learned down the road, and of course, I'm a local control kind of person, being a superintendent and teacher by trade and so forth, is that, but I say this at our state level all the time, is that that there's a reason to have regulation and to have rules, and that's to prevent bad behavior and to prevent fraud and things like that, which is a very real concern. But it also, when we have regulations and rules like that that are so strict, sometimes it prevents innovation and really serving the needs of the people that we're working with. And I think one lesson to be learned is when this flexibility happened, it enabled people to go out and really serve the needs of their children in a pretty powerful way. It really focused those efforts. There's a balance somewhere on what those regulations are and trying to cut through those bureaucracies. I know when I was a superintendent, I used to always tell my staff, my leadership team, at what point are we getting in the way of great teaching and great learning? Because sometimes we would be in the way of that, whether it's some kind of bureaucratic thing we would do or some kind of, responsibility we'd give or paperwork or whatever. And I think, so we would try to step back from that and free up people to be as innovative as they can. And along with that comes these partnerships, Linda, that you talked about with the nonprofits. It forced schools and forced leaders to really work with these nonprofits in a way that they haven't before, or not as extensively. So an example would be the food bank. Food bank says we're going to have people come in and get food in the community. Well, guess what? You can't socially distance when there's 1 or 2 food banks in your community and everybody goes to that location. And so they would send food out to the campuses, and then we had volunteers come in to distribute the food. And that way you had a whole bunch of distribution points and you could better socially distance. And so, and hopefully this pandemic goes away at some point, but these relationships and the lessons we've learned hopefully don't, right? And that we can continue to build off of, whether it's Snack Pack for Kids or your food bank, or the relationships even with your state agriculture department and USDA and so forth. I think those are real positives that'll serve us down the road. And I actually talked to some folks at our state level just yesterday in preparation of this, and I just said, just remember the flexibility you gave and what great things happened when you did that. And I think they see that, and I think we all do, but there's a balance, obviously.
Thank you.
I think I would echo that, that flexibility that we were allowed helped us to respond with urgency and with compassion, frankly. We're able to fling those doors open. People are served, no questions asked. The other thing that stood out for me was this pandemic EBT. That was huge here and so important for the families in our district. So I think I concur with what others have said.
All right, we'll keep moving. So I'd like to talk about access next. It's clearly an issue whether you live in an urban city like Chicago or and within a food desert or in a rural community. How are you looking at potential gaps in reach and how to reduce deterrence in accessing healthy, nutritious food?
I don't know if y'all want me to start off again. I think that what we've really tried to do is we've talked a lot about the waivers that we provided and how that can really help try to spur some of the innovation, some of the different ways that how can you reach kids and make sure you're getting them the access that they need. Again, we recognize there's some gaps along the way and always look forward to getting the feedback and thoughts on how we can address a lot of that. But I think that that's what we're looking to do is just try to figure out what has worked in this pandemic and collect our lessons learned so that maybe these are some things that we can build into the program, whether that's just, making sure it's allowable for the future. Some things might take regulatory changes, or is it working with the Hill on, these are some good flexibilities, some things to have should we have another natural disaster or a pandemic or some other crisis that should trigger the need for this so we can even respond even more quickly. So those are some things that we're trying to look at as well for how can we make sure we have the access, going into the future, that, we can kind of activate as many flexibilities as possible to allow our partners to really do what they need to on the ground to help serve kids.
I think in New York City, we've been universal for a little bit of time now, and it's been super helpful to be able to do that across the entire city. Now it's really just about planning. Where do we put sites to make sure we're serving the population? Where do we address those areas that might have more of a food desert kind of look to it? Just opening every single school allows us to address this need across the city. And I think that's why we're fortunate. Kids are coming back. It allows us to be more out there. It allows us to be in touch more with kids and families. It's a way just to communicate more. Having these folks at home, sitting home during the pandemic, you could lose sight of what you need to do during that time. So getting kids back into school is a real priority for us. And I think it will address some of those concerns.
I would echo that. I think I think a huge benefit in, obviously this is a terrible time and we wouldn't want this ever again. But there are some positives, right? And I keep thinking there's all these lessons I'm learning. I just wish I knew what they were now so that I could really feel good about it. But there are some that we're aware of. But, one is it forced our educators and parents and superintendents out into the community in a way. So, right off in March, we had superintendents across the state that were on the bus delivering food, handing it out to their children and their families. There's relationships that get built in there. There's a sense of ownership, and these are my families, this is my community, I got to take care of everybody. We had parents coming in and volunteering to help with those efforts. We had students even coming in and in safe ways to be able to do grab and go and this kind of thing. And I think that is a good thing anytime people are out in the community doing that kind of work and building those kinds of relationships. That extends far beyond the pandemic, in my opinion. And I go back to, like, when I was a superintendent, we'd use Snack Pack for Kids, which was, we would pack probably a lot of y'all are familiar with it, maybe not, but we had volunteers that would come in and pack nutritious food for kids that would be, teacher would slip into the backpack on a Friday and it would go home with them for the weekend, because that's really one of our biggest concerns is the weekend. And we have an army of people that are interested in this issue in particular. And I think that gave them a place to volunteer their efforts to make a difference out in the community. And I think we're seeing more of that. The same with the food bank. I think it raised the level of interest in people on this issue. I mean, I remember driving down the street and seeing a line of cars a mile long, everybody waiting for food. And I thought, wow, this is the 21st century in the United States, and this is a big deal, right? This is not the same. These issues have been here a long time, but they're definitely more visible, more highlighted. And my hope is that we can move beyond this and really focus in on these food deserts and on the rural areas and things like, I mean, this sounds maybe but the imperfect foods are a big deal. Where you can buy produce that's not perfect, but it's much less expensive. Community gardens, urban gardens, all these kinds of things can also help. They certainly don't take the place of, but they can be one add-on thing that we can have. So I think all of those are really important. But if anything, I think hopefully we've built compassion in people. I think Dr. Fox talked about that, and focus on the whole child, which is such a critical part that we often miss in this era of high stakes accountability and all of that. We forget that these are human beings that live and breathe and have emotions. And at the end of the day, what we really want is for them to be healthy, independent, contributing citizens at the end of the day. And maybe this broadened our thinking of that on a national level.
I think the only thing I would add is that one key to improving access is making sure that people feel safe, so that the health protocols here, I think, were very important, or have been very important, that we communicate them clearly, very important. hats off to the essential workers, really, who were in the schools, for months and months and months, and are still there, doing the work, distributing the meal, preparing the meals, distributing the meals, but there were other essential workers involved as well, security, facilities, the administrators there. So certainly in the midst of pandemic, cases arise. There have been instances where we had to quickly stop operations at a site and find a close alternative and be able to explain where that is and why it was necessary, and so that the meals are not disrupted as we try to address the pandemic, and getting people into quarantine under certain circumstances required a shift in site, and being able to make those changes quickly was important.
Thanks, Ken. We know that the effects of the pandemic on Black and Brown students has been disproportionate. The effect, you spoke to it earlier, Kevin, just the effect on early childhood development for an entire generation. This COVID slide and student health, can you speak to your biggest worry thought given this new normal?
Did you ask me or did you ask Dr. Fox? I'm sorry.
Oh, I'm asking all of you.
Okay. Well, I'll just real quickly say, I think it is absolutely a crisis that we're in with our children. And the problem is we're not going to know that in a real way for a while. I mean, if you work in all of the people all know that, but the general public has a sense of it, but doesn't feel it yet. And my biggest fear is that as we deal with budget cuts coming up in the next years, that's the worst time to be cutting funding for education and for wraparound services for our students, whether it's counselors, social workers, food services, all those wraparound services. We have got to go above and beyond and extend services, not be considering cutting back. And I think the reality of state budgets and the federal budget will be such that it will be very tempting to cut funding at the worst possible time. And I was around, and I was a superintendent, and of course we had our financial crisis in 2008, but we had federal stimulus funds that carried us through 2011. And it was 2011 that we got pretty seriously cut, at least in Texas, and I know in many other states. And it was not until 2019 that our funding levels came back to where they had been a decade before. And we can't afford a generation, a whole 10 years. I mean, that's somebody's entire school career. We cannot afford to cut back on that. And I think we're going to have to really fly that banner for not just this year and not just next year, but for the next decade, to make sure that we can recover this generation of children and catch them back up to where they need to go, whether that's additional time, additional resources, summer, food, you name it, they're going to need it. And we will feel the impact of that as a society for generations if we don't get it right in the next 5 years. That's my opinion.
I really agree with Kevin here. The only other thing I think I would add is, Chicago is remote only. So this thing that we've done to protect and keep safe, this thing has consequences in itself. And as a pediatrician, obviously, I'm concerned about stuff like screen time, which is part of any model that you'd be coming up with in the age of COVID. How much time kids are spending on screens is huge. And the impact, we will see, but it must be studied. We have to understand, and we may have to adjust. The other thing, and it might seem funny, but as a pediatrician, I'm thinking about this masking thing. I mean, it's obviously another really super important thing we have to do. People have to wear the cloth face coverings, but what is the impact of this on children's development? You know, we got 43 muscles in our faces for a reason. We evolved this way, you know, and so much is communicated with gesture and expression. And kids who are acquiring language, they have to see how your mouth is moving, you know, in order to give kids who are learning English, kids who have other impairments. Let's say among kids who have hearing, you know, who have hearing problems, and the staff who work with them, we have to find ways around this challenge of the mask. So I'm just going to throw those two things in. They certainly are on my mind these days.
Dr. Fox, we welcome you to Texas. You're my kind of people. You come on down and work with us down here. I'd love it.
Come on up, man.
Yeah, I mean, I really appreciate that our programs can offer that human connection, especially, you know, they're designed to be congregate feeding where kids are around the lunchroom table and having that social interaction. They're getting the food that they need. And so I really am excited when I hear more schools moving towards in-person, just because as a mother, I have a 4th grader and a 6th grader. So I see it too, personally, every day, you know, the social impact, just what their eating habits have become, you know, their daily routine, and they just benefit so much more from being in person in school. So I'm excited that we can, you know, do as much as we can to move that direction as safely as we can.
So can you provide your viewpoint on the role that community-based organizations like Common Threads and so many others should play in supporting families during the school year? We've, you know, gone virtual and have a digital platform and are in ready position to get back into the kitchens and the classrooms to provide our programming, which is so important, that hands-on piece in supporting SEL. So can you talk to, you know, that role that community-based organizations play in supporting all your efforts around health equity?
I think, let me just jump in here. My first thought is we are going to lean on the creativity of community-based organizations. Like, you're incredibly nimble, you're adaptable, showing us the way, pointing the way, you know, in those regards. I think that's of immense value to us. And also just the partnership, you know, maintaining the partnerships, you know, that we do this through thick and thin. You know, this is incredibly important in how community-based organizations show up for us in the district. I think it's incredibly important here.
Yeah. Linda, I would just say, one is I appreciate the mission of Common Threads and the work that you're doing. And having been in, you know, I was in San Antonio for almost 20 years, and we were considered one of the fattest cities in America. And we really worked hard on changing our food services in the school and doing family outreach, and even designed our cafeterias to have a family kitchen where you could do demonstration kind of cooking, and we embedded it into our PE classes about all kinds of you know, it was the vegetable of the week or the fruit of the week, and kids would dress up and they would learn how to cook different things with it, and the family would, and bring people in. And I think we were able to move the needle significantly, not enough that we need to, but we've got this, you know, the other epidemic that we have in America is obesity, and it's people living relatively sedentary lives, even more so right now probably, and not really being informed about what's available to them. And so I think that partnership is huge because, you know, when you go to be a superintendent, they don't talk to you about food services. They don't talk to you about all those kinds of aspects. Usually come up through the education ranks to do that. And so we depend on partnerships for that expertise to come in and be able to do that. But we were able to change everything we did about the way we provided food. And actually, a cafeteria, I'll just say this, is a social spot in a school. And if you are in a community that has diversity of socioeconomic status, like my old one was, we had very affluent families to very poor families, the cafeteria can be a really great place for people to come and be together on a social aspect. But the food has to be great to get them all there, and the environment has to really work. So I just think those partnerships helped us to rethink the way that we had school every day. And I think it made a huge difference.
Yeah, I would echo a lot of that, and the fact that the community-based organizations can be nimble, they can bring the innovation, and they really are, you know, it's essential. And a big shout out to Common Threads too for what you're doing with your virtual summer camps. My daughter and I got a chance to do the cooking class. We made picadillo. I was a little intimidated with the long ingredient list, but it was so much fun. They bring on these great celebrity chefs who are fun and energetic, and you could see the kids were excited, they were engaged, they were doing some activities, and so it was really fun to see how our partners like Common Threads are really making the shift to how do we reach kids. If we can't see you in person, let's get you some great educational opportunities and engage with you when you're at home. And so that was a really fun and creative way for you guys to connect, and I was really excited to be a part of it. My daughter still talks about it and wants to know when we can come back. So I'll put a plug in for us. We're happy to do another encore presentation if you need us, but it is really great to see how quickly folks have adapted and tried to change and reorient their programs, you know, to make sure we're reaching folks in this virtual environment.
I second that. That was just a great thing to experience and see. And this is a time that we need more stuff like that. So thank you, Linda.
Well, I'd love to, you know, end this by a call to action. And I'm curious for your thoughts. And I think this is a great time to say what support you need from the philanthropic and the corporate community. It's a time when we all need to be collaborating together across sectors. So any thoughts around that?
I mean, what immediately comes to mind for me is just continuing the communication. It really is just bringing ideas to us. How can we make this work when I kind of view COVID as happening on Friday the 13th? I mean, it was March 13th. I remember getting the call my school was going to be closing for just 2 weeks. And it was Friday the 13th. And so then we had so many people who were calling from private sector companies to the community-based organizations. How can we help? We have food. We want to move food. What do you need? What do schools need? And it really is just, I think that we've learned a lot through that process. And I think it's just making sure our lines of communications are open, bringing us ideas and seeing what can we do to help partner and make those things really become a reality, and given states, schools, you know, local partners that flexibility that they need to, you know, work with others to make things happen. So communication's key. Keep bringing us the ideas. The federal government, in my opinion, you know, you guys are on the front lines. You see it happening. We're not the be all end all. We want your ideas and how we can make those come to, you know, work alongside folks to make it a reality.
I would just add to that, and I totally agree. I think that every partnership has a ripple effect. And the one thing that I would say to partners is don't expect immediate results. This is a long game that we're playing. And when you teach somebody a new skill, like how to cook nutritious food, it's not like, there's this immediate result in that family, but it can change the trajectory of that family for that child. And you don't even know how far it goes. But they really make a difference. They really help move the needle in your community. I've lived that as a superintendent. I've seen it happen. I've even seen it happen with my own children, where they would come home and tell me things that they had learned because another organization came in and did a demonstration on something. And so the next thing I know, I love spaghetti squash. I've never had it before, but I love it. It's that kind of thing that makes a difference. But they really do make a difference, and it's going to take everybody working together to kind of crack this nut. And schools have a big role. Federal, state does for sure, but so do our partners in a big way.
Well, thank you all so much for participating in the panel. It's always such a pleasure to see you all. I can't wait to see you and break bread with you in person, please, soon, hopefully. I'd love, we're a learning organization, and this is our second virtual panel that we've done, and we plan on doing more in the future. So please tell us what you think. Take the exit survey, and we hope to see you at future panels. Thank you, everyone. Thank you, Pam, Chris, Ken, Kevin. I'm really grateful that you made time and space for us today.
Thank you, Linda.
Thanks, Linda.
Thanks, everyone. Have a great day.